Horses are special animals, and their healing powers have been recognized for thousands of years. Today we will describe how the early intervention of therapy will help children with cerebral palsy. We will explain how cerebral palsy affects children, introduce the therapy known as hippotherapy, and discuss how this benefits children. First, I will explain what cerebral palsy is. Cerebral palsy is a non-progressive disorder of movement, muscle tone, or posture that is caused by damage that occurs to the immature developing brain, most often before birth. Cerebral palsy's effect on functional abilities vary greatly. Some affected people can walk, while others cannot. Some people show normal or near normal intellectual capacity, but others may have intellectual disabilities. The disability may be limited primarily to one limb or one side of the body, or it may infect the entire body. Signs and symptoms may vary greatly, which appear during infancy or preschool years. In general, cerebral palsy causes impaired movement associated with abnormal reflexes, floppiness or rigidity of limbs and trunk, abnormal posture, involuntary movements, unsteady walking, or some combination of these. People with cerebral palsy may have reduced range of motion at various joints of their bodies. Due to muscle stiffness, they may also have problems swallowing and commonly have eye muscle imbalance, in which the eyes do not focus on the same object. Brain abnormalities associated with cerebral palsy may contribute to other neurological problems. People with cerebral palsy may also have seizures, intellectual disabilities, or mental health conditions. It is important to get prompt diagnosis for any movement disorder or possible delays in your child's development. See your child's doctor or if you have questions or concerns about episodes of loss of awareness of surroundings or abnormal body movement, abnormal muscle tone, impaired coordination, swallowing difficulties, eye muscle imbalance, or other developmental issues. Cerebral palsy is caused by an abnormality or disruption in brain development, usually before a child is born. In many cases, the exact trigger is not known. Factors that may lead to problems with brain development include mutations of genes, maternal infections, fetal stroke, infant infections, traumatic brain injury, or lack of oxygen. Most cases of cerebral palsy cannot be prevented. The brain disorder causing cerebral palsy does not change with time, so symptoms usually do not worsen with age. However, muscle shortening and muscle rigidity may worsen if not treated.
Next, I will be talking a little bit about hippotherapy. Hippo is a Greek word for horse, and hippotherapy means the therapeutic use of horses. But hippotherapy shouldn't be confused with for therapeutic riding. Hippotherapy is a medically based treatment tool, while therapeutic riding it involves teaching people with disabilities equestrian skills. Although Hippocrates first mentioned using horses therapeutically in his ancient Greek writings around 400 BC, it wasn't until the 1960s that physical therapy in Europe began using horses to help patients with neuromuscular disorders such as cerebral palsy and also brain injuries. Physical therapists believe that a horse's movement created a neurological change that helped improve a person's postural control, strength, and also coordination. A little about how hippotherapy works is that one can say that simply being on a horse can be therapeutic. Through hippotherapy, a child can experience many different types of beneficial sensory stimulation. Muscles and joints receive a deep pressure stimulation from bouncing and holding positions, such as kneeling on the horse or also standing on the horse. And the brain receives vestibular stimulations to sense movements and balance as the horse moves in circles, up and down hills, and also changes speeds. Hippotherapy provides the sensory stimulation that helps a child organize their body for complex tasks. For some children, this may be as simple as being able to produce voice or vocalization. For others, it may be using multisyllabic words or even telling a short story. Also, because a horse walks with a gait that's similar to the human gait, such as the variable, rhythmic, and repetition, a child who has never walked or has an abnormal gait can sit on a horse and experience what a normal gait would feel like. The therapist is always in control of the horse's movement, choosing activities that will help achieve specific outcomes. Some examples of this would include reducing muscle tone with slow rhythmic movements, or improving attention and postural control with fast erratic movements. Decreasing defensiveness or sensitivities with full body contact can also be an example, as well as improving right and left coordination by steering with the reins. Developing visual motor skills while hiding puzzle pieces along a trail that need to be found is another skill that can be developed. Horses can be a powerful motivation. This enthusiasm can be leveraged into teaching communication, social, fine motor, or any target skill. Children may feel more comfortable communicating with a horse than a human. Luckily, therapists can help children direct their horse friends by using all modalities of communication, including sign, vocalizations, and also picture exchange.
Now I will discuss how hippotherapy benefits children with cerebral palsy. Overall, hippotherapy is to improve a child's cognitive ability, body strength, and endurance. During a therapy session with a child with cerebral palsy, the therapist may be working towards strengthening muscles, improving balance, and flexibility, along with fine motor skills to help everyday tasks. Within a therapy session, a child will experience the horse's movement. The horse will move in a gentle, repeating motion, gait, and tempo. The movement of the horse will allow the child to be challenged, stimulating their balance and motor control. The child may simply enjoy the different environment in interacting with the horses. Children will also be able to build relationships and friendships, and when they build these relationships, they will learn from these relationships, as in if another child is there during their therapy, they will be able to interact with them and learn and put that into their therapy session. Depending on the child's physical and mental abilities, the difficulty of the therapy session may vary. Therefore, the child will benefit from overall strength, as in trunk and core strength, gross and fine motor control, gross motor control as in big movements as in their arms and their legs, and fine motor control as in their fingers, balance and posture, whether it be on the horse or off the horse, maybe walking the horse, muscle tone, ability to respond to verbal cues, whether it's the horse that they're communicating with or the therapist, sensory issues, communication skills, social skills, and confidence and self-esteem. In summary, we have covered what cerebral palsy is, along with what hippotherapy is, and the benefits of hippotherapy with children with cerebral palsy. Thank you.